Hey there, I'm Dr. Angie, and this is my pug, Mr. Pugsley. They're about ready to mow lawns outside, so hopefully he doesn't bark too much, but he's about ready to get pretty upset. So in this video, I'm gonna be answering pet parents' questions, and we're gonna start with Leslie. Leslie writes, my cat is 13 in the early stages of kidney disease. I believe that the prescription diet care food is making him worse. I would love to know what's happening on this diet. Could you tell me what cat food might be best? Also, is there a natural supplement that we could give him to help as well? Thank you so much, Leslie. Thanks, Leslie, for your question. Now, in kidney disease with cats, it's really controversial and unknown when we should start restricting protein. We know in... Sorry. I feel like this happens every time. There's like no good time to record. Pugsley, sit. Sit. We don't really know when cats should be protein restricted, and we don't have evidence to show that it helps in all stages of kidney disease. What we do know is cats require a very high percentage of protein, and when we decrease or restrict that protein, we cause muscle wasting and other symptoms. So in early stages of kidney disease, I don't recommend protein restriction, and in my own cats with kidney disease, I don't protein restrict them at all, and that was probably where I differ from other veterinarians that follow a more traditional path. I think cats tend to do a little bit better if we give them protein for longer. Now, if you want to use a kidney diet that also is low in phosphorus, which is important, and we do know that that helps, Blue makes a veterinary line, and they have a kidney diet that's not so restricted in protein, but does have low phosphorus, and that can make kitties feel better. I'd recommend getting it in a wet form and not dry. I hope that answers your question. Lisa writes, my 2 cats love coconut oil. I give them a dab of it on my finger about 3 times a week. Is it okay to feed them coconut oil? Will it harm them later in life? So Lisa, I don't think it's a problem to feed them coconut oil. I think coconut oil is a little bit overrated. I don't think it's as great as we think it might be, and it doesn't necessarily have the best fat profile. It's not as complete. It doesn't have any omegas. I think there is some utility, but I don't think it's as great as all the hype. If you look on social media, coconut oil will fix anything. So I think it's okay if your cats enjoy it, but I'm not sure how therapeutic it is given orally 3 times a week. The next question is there any research on hemp, CBD, and hypothyroidism? There's no research that I know of studying CBD and hypothyroidism in dogs at this time, and I haven't come across anything in the literature specifically looking at hypothyroidism in people and CBD. Are there any homeopathic remedies you suggest for hypothyroidism, or is it too individual? I don't practice homeopathy generally, so I couldn't say there. How much iodine is too much if I wanted to give some extra? I wouldn't give extra iodine. Depending on the diet you're feeding, I wouldn't give any more because it actually can cause problems the other way. I'm trying standard processed thyroid and thyroid support and increasing iodine slightly before retesting in 2 to 3 months. Dr. Peter DeBias suggests trying natural before going synthetic. I'd love to add a homeopathic remedy too. I haven't really had any success avoiding synthetic thyroid medication when it's really needed. I've had one patient where we changed his diet and his thyroid about within the last 6 to 12 months after changing the diet was completely normal. So I have seen that diet can be really important, but I haven't seen that very often. And I haven't seen a lot of success using the glandular supplements like standard process. I think they can be supportive and helpful. I just haven't seen them help me avoid the synthetic thyroid hormones. Most dogs actually do quite well on them and they feel a whole lot better, but let me know how it goes. The next question is from Richard and Nancy. We are having an issue with our male ragdoll, 10 years old. He has IBD and nothing is working to help minimize his symptoms. We tried prednisone and many food combinations. Nothing seems to work. He's had a colonoscopy and other exams. Any suggestions? Yes, so I would make sure that you're working with an internist. It sounds like maybe you have. Make sure that you have biopsies. It might be time to go in and get full thickness biopsies. And when prednisone doesn't work, I usually try budesonide, sometimes even chlorambucil, which is a kind of a heavy-hitting drug, but it can really offer a lot of relief for these cats that aren't treatable with prednisone or budesonide. So I apologize for my dog. He's so embarrassing. I would try moving up in the medication, kind of up the medication pyramid. And I'd be interested to know if you're working with an internist, because they can be really helpful in these situations. Linda writes, thank you for all your info. I need your thoughts on why my sister's cat got so sick and had to be put to sleep. I'm so sorry to hear this. Goldie was a 13-year-old spayed female. She stopped grooming herself and was severely matted. So that tells me something was going on right then and there. When cats stop grooming themselves and become really matted, I worry about what kind of disease is already happening. Absolutely nothing out there. Pugsley, let's just turn the other way. Pugsley needs an extra shot of CBD today. Here, let's go this way. Let's look this way. Okay. My sister took her to get shaved and was advised she needed a rabies shot. She was always an indoor cat, so she got one. So that's troubling to me, because if she's not grooming herself, I would want to know that she's healthy before giving her a vaccine, and obviously she's not if she's not grooming herself. So I try to only vaccinate healthy animals, especially an indoor kitty at such low risk for rabies. Before I would want to give her a rabies vaccine, I would want to make sure that she's healthy. About 2 weeks after, she wasn't herself and returned to the vet. All blood was done and all was normal. The globulins were slightly elevated. It seemed her appearance changed, very lethargic and not eating, falling over and urinating on the floor. We are baffled. She was fine before getting shaved and the shot. So it sounds like she wasn't fine before she got the shot, and I'm curious to know what was really going on. If her globulins were high, something like FIP, feline infectious peritonitis, comes up, and I wonder if they were able to do an autopsy. I'm so sorry to hear about this, and I hope you can find some peace. Okay, so Carol is wanting to have an air purifier for her kitty with asthma. And so when I am treating cats with asthma, I always use CBD. I use a Chinese herbal formula called Sanrentang. I have great success with that, and I try to get them on an anti-inflammatory diet. And for cats, that means canned food or a raw diet or some mixture of both. Basically, I need to get them off the kibble. If that doesn't work, I can always control asthma, well, almost always control asthma with some sort of steroid. And there's 3 ways that we can, right by now. I'm so sorry. We can give steroids by inhaling them. So we can use an inhaler, and they make a little mask for cats that you stick the inhaler on. It's got a little adapter, and you can puff it and put it around their face. Most cats need to be trained to use it. It is possible, and that's really helpful. Or we can give them oral steroids, and usually prednisone. If neither one of those work, you can use injectable long-term steroids. But I don't love using those. No veterinarian loves using those. The danger with those and other steroids is that some cats become diabetic on steroids, and so we try not to do that. The risk is a little bit higher when we use the injectable steroids, but cats that won't be pilled, or we can't get the inhaled steroids in there, that just doesn't, we just have to do something so they can breathe. And then as far as air purifiers, I think a HEPA filter would be a great place to start. And I noticed in your question that you mentioned that it's hard to find dust-free litter. And I agree. I mean, there's dust in almost all the litter. Some is more dusty than others, or some are more dusty than others. But let me know what you think. The CBD can be quite helpful too. And usually I'll just work up. Start with CBD, I use Sanrentang, and then I use steroids, and then I use inhaled steroids, and then we kind of start stepping back down. So I hope that helps. Keep me updated. Isabel writes, hello, my dog was recently diagnosed with a thyroid tumor. My vet prescribed Fosamax. I looked it up and I'm a bit wary of the list of side effects. What are your thoughts on Fosamax as a treatment and what would be a good alternative? So Isabel, I have to be really honest that I've actually never diagnosed and treated a case of thyroid carcinoma in a dog. It's not that common. Usually when we find thyroid tumors, they are 90% of the time malignant, and they tend to metastasize or spread. So I'm not sure who's helping you, or I don't really know about the viability of Fosamax. I haven't heard of that used as a treatment for thyroid tumor, and it sounds like I probably don't know enough information about what's going on. I'd recommend working with an oncologist and making sure you have all of your options laid out for you. I wish I could be more help, but I want to speak more from experience than anything else. Margaret writes, do we have to use organic chicken, and should the fat be skinned off when I'm making bone broth? I like to use organic chicken if possible, but it's not necessary. There's still a lot of benefits to making bone broth, even if the chicken is not organic. I make a very weak broth at first, a 90-minute broth, so there shouldn't be that much fat at the top to skim off, so I wouldn't worry about that. Now, if you cook it for 2 or 3 days, like in a slow cooker, then I would, especially if your animals are sensitive to fat. So I hope that answers your question. Barb writes, my elder dog, who will be 13 in April, has been diagnosed with idiopathic vestibulitis. The antivert pills she was on worked. After 5 days, the pills were completed, the symptoms returned. What do you suggest she could take to help with this? I put her back on the OTC meclizine tablet, but not much improvement. She's ambulatory, but still not willing to jump in the car and go down any stairs. Yeah, this is really difficult. Sometimes what happens for older dogs is they get stones in their ears, just like people, and it makes them dizzy, and maybe they'll start circling to one side, or they can't walk straight, or their eyes will start ticking to one side. I have seen success used, if you can find a veterinarian that does physical therapy or a PT physical therapist that does dogs, there's a certain maneuver you can do where you put them on your back and, so you lay on the floor, you put them on their back on top of you, and there's a way that you can try to move those stones out of their ear, and I've seen that be successful. So I think at this point, since your pup's refractory to treatment, that's what I would look for. Let me know how it goes. Carolyn writes, what do you recommend for fleas? Unfortunately, we do have fleas in the area. What can I give Maddie that won't hurt her? Please, I would be so grateful. All the vets want to do is feed her meds. She's on heart meds, Interceptor Plus, as they don't carry HeartGuard. I will keep trying to find HeartGuard. Thank you, Carolyn and Maddie. So Carolyn, I have to admit, I hardly ever see fleas. I think you should just move to Boulder, Colorado, because we really see fleas so rarely, and we don't often prevent for it here. So I must say that my ability to know what a good alternative treatment is and have used it in practice is just, it's not very good. I don't have a lot of experience. Flea Busters is a program a lot of people really like, and there are ways where you just comb the fleas out every day, and then environmental control. But depending on where you live, I'm not sure how helpful that will be, and for some infestations, things like frontline are just really necessary. So let me know if you try something natural. Pugsley's already fell off my lap. If you try something natural, just let me know how it goes. I'd be interested. Janice writes, you had mentioned submitting a question to be answered weekly on Dr. Angie's podcast. I don't have a podcast yet, but hopefully I will. Not sure if this question qualifies, but maybe you'll have a recommendation that I can research. I would love to answer your question. Jackson, our kitty, has tumors throughout his lungs. I'm so sorry to hear that. Inoperable, as he wouldn't have any lung left. He's almost 14 years. He's doing well with the CBD oil I purchased from you. All is going well except that he has fleas. Oh my gosh, more fleas, which are bothering him enough to interrupt his quality of sleep. I've been told that the flea product Revolution would be safe for him with his issues and that I would give it once a month. I'm concerned that it might be too harsh for him at this time in life. That while it would kill the fleas, it might cause harm to his system. Have you heard of this product? Yes, I have heard of this product and I've used Revolution. Do you think it would be okay to give him? Or is there something else you would recommend? I'm trying to weigh negatives versus quality of his sleep. I'll look at Dr. Mercola's product too. So if he were my kitty, I would use it. If I lived in an area where fleas were endemic and it was interrupting the quality of his sleep or life, I would definitely not hesitate to use Revolution. It's not the most natural thing to use, but I think it could really help him feel better, and it could break the cycle of infestation in your house. If you have a question you would like me to answer, you can email me at Angie@boulderholisticvet.com, and I will talk to you next week.